Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll.
Thank you very much for agreeing to join us today.
Thank you for having me
on another session. And today we are talking about NCDs and COVID-19 and experiences as either someone who lived with or as a caregiver, and there are lessons that we can learn from that for the future. But before we get into all of that, let's start with the introductions. Give us a detailed introduction of yourself and what you do, and then we'll sort of pick it up from there.
All right. Okay. So thanks again, Stephen. So yes, my name is Sharon Mbugua, and I do a couple of things. I think first of all, I'm the team lead for the Mental Health Alliance of Kenya, and we came together as we considered ourselves a group of influencers. We're able to just give a voice to people living with various intellectual, neurological, and mental health disorders, all those grouped together by WHO. And then we figured, okay, we are advocates in our own right. How about we come together and see what we can do to influence policy? So that's the journey we're on, policy and advocacy. The other thing I am is a member of, it's a mouthful, KAWE, Kenya Association of the Welfare of People Living with Epilepsy. KAWE. And what KAWE is it's just that. It's a national organization that draws members from different parts of the country living with epilepsy. However, the epilepsy has been caused. So those who are born with epilepsy, those who are caregivers to people living with epilepsy, just all things epilepsy. And in my case, I say that I live positively with the condition because I was diagnosed in 2018 as an adult as a result of head trauma. Because I had brain surgery. And so initially it was very confusing because seizures were happening and I had, your MRIs were clear, and it was just very frustrating because then you don't have evidence of not being well. So I say my diagnosis was actually a blessing because then at least I have a name, and then I'm now able to go back and study about the condition. So that's who I would say I am. Yeah. Interesting,
the fact that and I love it when you say that you live positively and that the diagnosis came as a blessing, because otherwise the brain keeps going back and forth thinking, what is this that is not being diagnosed?
Right. Yeah, that's it. Okay. Yeah, and actually just to and it's probably come up as part of your interview, but epilepsy, which may sound like a big confusing word, is actually just the name given to a group of unexplained seizures. So once you have about at least 2 seizures that you can't immediately explain, then we say you're living with epilepsy. Yeah,
I think that sort of simplifies it because people don't really tend to understand what epilepsy is,
right?
And especially when the seizures happen,
right?
And the immediate thought it has something to do with religion, or it's something that was passed to your family or stuff like that. So explaining it simply like that, I think, helps clarify a lot of the conversation around epilepsy.
No, it does. It's often misunderstood, and you're right. The stigma is so real because even today you have people who will keep the people living with epilepsy enclosed in their homes. Same script of witchcraft, of madness, of, you know, just all these things that are not the case and not things you can control. So it's really unfortunate for a lot of people living with epilepsy, especially up country, but it's true, and I love what you're doing, and we just need so much more awareness of what it is, and just simplifying it, normalizing it, so that people are able to appreciate and say, oh, okay, so that seizure was just a symptom of what this person is living with. Let's see how we can support them instead of judging them.
And we are always very happy to sort of have this conversation, because even for us, the fact that we already have a huge platform and a huge following and a huge listening, it then becomes almost as a responsibility for us to ensure that other disease conditions that are still not well understood, or that people still don't understand about, that we get to talk about them more and more, just so that people get that. All right, so interesting question. As a person who has been living with epilepsy, talk to us a bit about that experience, especially during the COVID-19 era. Like, what was the experience living with epilepsy during COVID-19?
Yeah, so in my case, I wouldn't say I was as directly affected, meaning I was still able to access my medication, and I was still able to, I guess, pretty much function. The other title we use is when you are functioning more or less normally under medication, then we say you're controlled. So I was pretty much able to live a controlled life. What I can speak to is people who are, as people living with epilepsy, we're in a support group, a WhatsApp support group. And so I could see conversations about challenges with access to medication. Again, just because of the quarantine and the closures, it's not able to get to centers, because the other thing Kawe has done is set up some model clinics in Nairobi, really just to be able to show Ministry of Health, because they would actually set up the treatment containers in the grounds where the MOH officers are. And the idea was to be able to show MOH at its devolved level that you are able to just run a simple clinic where you just have someone who comes, they're checked on, they're given medication, and they go. So those centers, which the people living with epilepsy, at least in Kawe, really rely on, there was challenges getting medication there. And you could see people, people's loved ones from Garissa trying to look at, okay, how do we get to Nairobi? We might even get there and we might not get the medication. So that was a big one. The other big one around, especially the what could I call it? The transport movements, where you are sick, for instance, and you're not able to get to a checkup center on time. So it's really around that health, that movement, and the medication conversation, more so for my colleagues in the epilepsy space.
But back also to sort of the other space that you present, which is mental health and people living with that. How was the experiences? What are the stories that you're getting as a group, as an association, about your members during the COVID-19 era? How was that looking like?
So I think for us, as an economy in general, yes, we have the voices saying that we're doing well and we're growing, but on the other side, I think we are a very price-sensitive economy, and so as soon as you lose a job, and if Stephen loses a job, Sharon ends up picking his job and someone else's job, and leads to the stress levels. So I think a lot of the stories I would hear are triggers of stress, which leads to different kinds of, especially psychosocial. So your depression, anxiety, a lot that came through. A lot of gender-based violence, again, triggers to just your mental health conditions. I think those are the ones that I would hear quite a lot in that space, because you have quarantine and people living in close spaces, and you're forced to be together as a family. And if you're a healthy family, you will navigate your relationships positively. But if not, then that's when abuse begins, and you are increasing, immediately stress levels go up, and all those byproducts of stress mentally start coming up. Yeah, specific to our association, we actually came around one of our members who wanted to be, or ended up being, a representative of users and caregivers on the mental health task force. And they did great work and came up with a very comprehensive report right at the end of February, just before COVID. So all that conversation, all the recommendations were packed, all focus given to COVID. Last year, some of that starting to lift, so which is how then you saw the launch of the task force report and all that. But I think for us as an association, I would say that was a direct effect, because whereas we could have had information and tools and all these things to support us and people living with mental health conditions, all that was put aside in favor of focus, on appropriate focus, definitely, but what about all the other conditions? I feel like it was at the expense of a lot of other, conditions that people are living with.
It's very interesting, because then the conversation was true that during COVID-19 people were like, so whilst the focus was there, everybody started to get affected and even die from all the other conditions that were not focused on, because care was not available. But anyway, so looking at the experience that you had during COVID-19 on both ends, and also like the challenges that it presented. I guess the first question that I ask is then, have we learned, or are we learning did we learn from the pandemic? Did we pick up lessons from there that perhaps could better prepare us for the next one?
Good question, and it was interesting what Monica felt that we haven't learned. I feel like we have some learnings. We still have a lot to do. I think from where I sit, overseeing the association, different leaders of different associations. So we have, say, leads of Autism Association or Down Syndrome Association. I think in those spaces, they've been able to come out with louder voices to speak and to advocate for the conditions, because you can imagine at that time when most conditions were sort of forgotten in the focus of COVID-19. So now we have come out of it and we're saying, okay, let's even amplify those voices louder, just for care, to almost like come back and have the care and the treatment support for those different conditions. So the other thing I think I could say we've learned from is just that whole national focus on mental health in general. So for me, then, even when we're coming together and we're having policy and advocacy conversations, it feels easier, because it's not something new that I'm coming to tell Stephen. This is an important conversation. I think we had a lot of advocates who don't even live with the conditions, but are friends of or family of, just coming to speak out and being in that journey of normalizing. At least let's have the conversation. Let's not ignore it. Let's just agree. We have it. Let's talk about it. Let's talk about it. So I think that's definitely been some learnings from it. I still think we have, I feel like as a society we have short memories. So my suggestion would be to to kind of look back at documents of all these and all the information around the pandemic, and just encourage people to go back and refresh themselves on what happened, what were some of the activities that came out of it, how can we best prepare for another, whatever kind of pandemic. I feel like that's a step forward in terms of going forward. Yeah.
One thing you've said there that sort of strikes me, because I'm a big advocate for that, is documentation and recording.
Yeah.
Because right now it's just beginning to come out.
Yeah.
And it's as if 2020 and 21 didn't happen.
Yeah.
And so people are beginning to forget how it was like, and even forgetting to pick up the critical lessons for that.
Right.
So I guess the question is, and maybe even a challenge then to ask that we are still not very far away from when it happened.
Right.
We still have a very good opportunity to document all of the lessons. So I guess a question or something for you to sort of put your opinion on is what do you see as the role of documentation, especially for organizations like us whose focus is not primarily on things that generate revenue, for example, which are considered more important in the larger scale of things, in terms of documenting these experiences and proving a case for ourselves and even for the government, really, that this action is very much needed.
Yeah, I think it's a no-brainer, Stephen. We just, I think as associations, organizations who sit in these spaces, it's the challenge is on us, and I think Stowelink is doing a great job. So it's the challenge is on us to document, to go back, to collect stories, to share them in friendly ways, accessible ways, for the wider society, and to just keep the conversations alive to the best of our ability. We have different channels of communication, we have different platforms, definitely. But if we can do that, if we can encourage people who are, you're not even necessarily directly affected, but you're sitting there and you know somebody who lives with a mental health condition, for example, you know, where you're able, and I'm saying that specifically because I have a good friend who has written a book around just practical exercises or practical things you can do to manage your mental health. Sorry. The other thing that's important to do is to document and share with security providers like the insurance spaces, so that we come together and we build enough of a case for them to create mental wellness packages, so that at whatever, well, I guess that insurance, there's only a certain level you can support, but to the extent that people are able to support, then I know if I'm diagnosed with cancer, if I'm diagnosed with diabetes, for one, I'm not immediately getting stressed, and then two, I know if I get access to an insurance provider, they have some kind of mental wellness package for me. So I'm also doing preventative care, and I'm down the road where I need treatment, I am accessing that treatment undercover.
Interesting. And that could lead us to a very, very interesting conversation there, but well, that's for another podcast.
Not for now.
All right.
Yeah.
So I guess finally is what are the key takeaways from you and both of your work in experiences with mental health and epilepsy, for example, for the normal regular guy, in terms of one or two learnings from the pandemic that you should put in place, but also if any strategies of preparation for a future pandemic, because as we saw, this is not the last one, and probably the next one might come even sooner.
Might come even sooner and even stronger. I think, just even to add to the the person who just came ahead of me, there's no loss of information. Just to keep where you have the information, to keep sharing it and to keep encouraging the public to just be informed, build your level of awareness. Again, normalizing those spaces where now that you have learned, for instance, about epilepsy, get curious and go see what are the two other things you can pick up on. What are the two things you can pick up on as anti-stigma, so that now those are practices you start consciously living out. Mental health in general, again, just encouraging, I think, the public to be curious, I think is a key takeaway, because that immediately moves you to the next step of wanting to find out more at whatever level, and get into spaces where you're normalizing these conversations. I have spoken to somebody else and they are learning and passing on the information. So I would say information, I would say encouraging public to be curious. I think that even extends to coupled with the curiosity and those of us who have the knowledge, documenting and sharing. I think those two go such a big way for knowledge management ahead of any other pandemic. Yeah, so we are caught less of a surprise. I don't think that our government systems have built up on enough of disaster management, but we are caught less surprised and more ready. Yeah.
Than we were with COVID.
COVID.
All right.
Yeah.
Thank you very much for coming on board. That's really some great insights there.
Yeah.
And let's see you on the next one.
Let's see you on the next one.
All right.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.